Good night everyone, Mr. Lochan here at the lab again, and wanted to share something with you. I know I've done this or something closely related to it in the past, but because of what we continue to see, we hope that what I'm about to share with you will help someone better understand this test that I'm about to go through, and also help you live a more healthy and a more victorious life. So today we're going to talk about the complete urinalysis. It is a very important test, but before we talk about the test, let's talk a little bit about anatomy and physiology. Anatomy in medical terminology means shape. Physiology means how that particular shape or that organ or that tissue is suited for its function. So anatomy and physiology. When we look at the kidneys here, we've got our two kidneys, and the kidneys are fed by a rich supply of blood. This rich supply of blood enters the kidneys, and the blood is filtered. And when that blood is filtered, the production of that watery matrix that we call urine comes out and through two ureters and fills our bladder. When we feel the urge to urinate, then the bladder leads out to through a urethra, and we pass that urine. Now, in most healthy individuals, the bladder is sterile, but from the bladder coming out to the urethra, whether it's a male or a female, it is generally colonized by some degree of microorganisms, and some organisms could also be non-bacteria. You can have things like fungal elements like yeast that can be commonly found in small quantities in the genitourinary systems of females. So when we talk about the kidneys, I want to relate the kidney to a comparison where the kidneys are like rice strainers. You know, when you boil your rice, you're going to have to put your rice and strain it in a receptacle, and that rice that is strained stays inside because that's what you want, and the water that goes out, that's what you don't use. So think about your kidney as a rice strainer. Think about damage to your kidney as when your rice strainer starts to become more porous, where the holes become bigger, and rice grains, which is like in your blood, proteins, valuable materials like protein and cells, etc., supposed to stay inside. Those are like your rice grains. And when there's damage to your kidneys, what happens is your valuable rice grains, your proteins, your nutrients, everything, these things can go through and pass out in your urine and cause problems. So one of the things I want to just share with you is the structure and the function of the kidney as it filters blood. And it's amazing to think that that urine that is in our bladder right now, just prior to that, it was in the blood, where blood, when it is filtered, produces urine. Right? Now we want to talk about the complete urinalysis. A complete urinalysis is three phases. A macroscopic phase where we just look at the color and the appearance of the urine. And then many of us will be familiar with the dipstick. It is that strip that is placed in the urine, and we look for color changes. These different color changes will tell us different things. Alright? When we talk about the urine dipstick, you've got 10 parameters or 10 things that are looked for, and these different parameters are specific gravity and pH. Specific gravity compares essentially the weight of urine in comparison to the weight of water. Water has a specific gravity of 1.000, and urine, if they are dissolved substances, gonna have a higher specific gravity. pH tells you about the acidity or the alkalinity of the urine based on diet, disease, exercise, certain types of medications can affect the pH, but there's a normal range approximately from 5 to 8. Leukocytes is the medical term for white blood cells. There are normally a small amount of white blood cells found in everybody's urine, because from the bladder to the outside, from the bladder to the outside, you've got a small amount of microorganisms, and they will cause a production or the encouragement of white cells to come to that area to ensure that these policemen keep these criminal activities and criminal elements in check, because your white cells are the policemen in the body. So you've got leukocytes, you've got nitrites also in the dipstick. Nitrites which is generally an indicator of high amounts of bacteria, because many types of bacteria break down nitrates in the urine and cause them to produce nitrites. So when you find a lot of nitrites in your urine, you are more than likely going to find a lot of bacteria. Then you've got protein. Think about the rice strainer analogy I just used, and if there's protein in the urine, it can be as a result of problems with the kidney. However, normal menstruation cycles in the female, strenuous activities, certain types of other activities, certain types of medications can cause what we call proteinuria, which is protein in the urine. So not everybody with proteinuria will indicate that they've got kidney failure. No, but it is a indicator that you need to check and identify what is causing it. Then you've got glucose. The presence of glucose in the urine is called glycosuria. That is usually found in instances of diabetes and uncontrolled diabetes. All right. Then you've got something called ketones. A very important thing I want to tell you in terms of the human body. The first form of energy used by the body is glucose. When glucose is not available, the body, this is just a simplified description. When the body is unable to tap into glucose as its initial source of energy, it utilizes it has no choice but to utilize other sources of energy. And these other sources of energy, they're not coming from glucose. It can come from adipose or fatty tissue. It could come from muscular tissue. It could come from even tissue from the organs. And that is why some diabetics suffer with what is called unplanned weight loss and even wasting away. And that is why you have these ketones. How we get it is because ketones are produced as a byproduct of the utilization of other sources of energy, not glucose. When glucose is not available or accessible to the cells, the body utilizes other forms of energy like adipose tissue, fatty tissue, muscular tissue, and in the breakdown and the utilization of these other materials, it produces ketones. Urobilinogen and bilirubin are breakdown products from the proper functioning of the liver, and these can indicate in the instances of urobilinogen and bilirubin are related to liver dysfunction, and that can give an indication as well of how the body is functioning, at least with respect to the liver. Then you've got the medical name for red blood cells, erythrocyte, and you can have blood in the urine normally or you can have it abnormally, and many times we are seeing patients that are not supposed to have hematuria or blood in their urine. They have blood in their urine. It could be from renal calculi, stool. It could be from renal disease. It could be from trauma, polycystic ovarian syndrome. It can be from many different things. But the finding of blood in the urine is an indication to the physician, coupled with their assessment of their patient, to know and identify what is going on. And hemoglobin is the red pigment found in the red cells. So you can sometimes find blood cells themselves, or you can find the component in the red cell, which is hemoglobin. All right, that's the dipstick. Then thirdly, you've got a very important part of the urinalysis that is not done in most routine physicians' offices. I, however, like this part a lot. I would like one day where all physicians' offices develop the ability to do complete urinalyses, not just the dipstick, and I'll tell you why. The microscopy, or the third part of the urinalysis, deals with taking a specimen of urine and centrifugating it or spinning it under high revolutions per minute, high RPMs, and that will cause particles to settle down to the bottom. We throw off the unnecessary part and we put the sediment on a microscope slide, and we look for cellular or particulate materials. These cellular or particulate materials are epithelial cells, white blood cells, which is like the policeman, red blood cells, transport gases, bacteria, culprits, crystals and casts, Trichomonas vaginalis, which is a parasite, and you can also get yeast, or what we call Candida albicans. It's interesting, wouldn't you agree, that the microscopy of the urine can find three different living things. It can find bacteria, which belongs to one class of organism. It can find Trichomonas vaginalis, that belongs to a second class of organisms, parasites. And it can find yeast, which belongs to a third class of organism, fungal elements. These will not be found in a dipstick all the time, especially Trichomonas vaginalis, which is a motile parasite, and Candida albicans. The physician gonna have to work closely with the signs and symptoms, and because not all diseases progress with very candid signs and symptoms, it is really good to do a complete urinalysis. It is good to do this part as well, which is the third part. So the first part is a macroscopic examination that tells us about color and appearance. The color and the appearance tells us a lot about the patient. And then this dipstick that most persons and most patients are accustomed to, because it's done almost regularly in all clinical environments. But this, whilst it gives a lot of good data, there's a lot of things that need to be discussed as well. Number one is the integrity of the testing method. Many persons may be using materials because it's easy to just dip in a urine. Viewers, many persons are not following the way it's supposed to be done, and they are deriving color changes, and they do not know how to interpret it, when to interpret it, and also the integrity of the test method or the kit. In addition to that, the third part of the urinalysis, very important. Seek consultation with your physicians, and when next you do a complete urinalysis, you're going to see a report according to international standards. You're going to see a report that says color and appearance. Then you're going to see specific gravity, pH, leukocytes, nitrites, protein, glucose, ketone, urobilinogen, bilirubin, erythrocytes, and hemoglobin. You're going to see that. And then you're going to see epithelial cells, white blood cells, red blood cells, bacteria, crystals, scars, Trichomonas vaginalis, and yeast. That's a complete urinalysis. That is what you should have regularly done with your physician's help. When there is a UTI, you may have your urine placed on a little agar plate like this, cultured onto the agar plate. This agar plate is incubated, and if there is a bacteria that grows significantly, we set up what is called a sensitivity test, where we subject the organism to antibiotics if it's a bacteria. And the zone of clearing is called a zone of inhibition, whereas the zones that are not, or they are not seeing any inhibition, those antibiotics cannot be used. And these, where the zones of inhibition are clear, those are the antibiotics that we will tell the doctor to use. So this, in a nutshell, is your complete urinalysis, merging with the anatomy and physiology of the kidneys, the important blood flow, etc., the bladder, then the complete urinalysis. Viewers, in a nutshell, please, when you go to your physicians, seek to get a complete urinalysis done. You will be amazed at what you may find. In all of our community projects and over all the urinalyses that we do, we find a significant proportion or a significant percentage of patients having abnormalities in either the color or the appearance, the dipstick, or the microscopy, let alone significant urinary tract infections. I hope that this has been helpful to you, and we remain very eager to help our people, our community, better help themselves in managing a healthy and a victorious life. Keep well, God bless, and take care. Medical Scientific out.